Good morning, all. Dr. Heera, I'm audible.
Yes, you're audible.
Good morning, all. Good morning, Dr. Heera. So
Morning.
today's present session will be on specific sports injury and its prevention in swimming. It will be presented by Dr. Heera. So I would request Dr. Heera to start the presentation. Dr. Heera,
Yeah,
can you take it forward?
yes.
Okay,
I'll just share my screen and then we'll start.
okay.
Good morning, everybody. I'm Heera. I'm presently working in Bangalore as a physio for junior Indian women hockey team. And previously, I worked in USA and with American football team in state of Michigan and with Henry Ford Hospitals. And today we'll be talking more about injuries, what can happen in swimming. So during all the lockdown, we had a lot of educational sessions where we learned about how we can prevent injury. Now we are going a little bit more specific into what exactly happens in specific sport, and today it will be more in swimming. So in introduction, I think there are swimming coaches here, and they all are really good at what exactly the technique is. I don't think I have to go more in detail about what exactly happens in swimming and what are the techniques of swimming. So if we come in general, definitely swimming is one of the less contact sport, and more of the resistance, whatever you're getting, is from the water and the buoyancy, what's there in the water. So what exactly is happening in swimming? So I have a small presentation to show. So there are different cycles in swimming. So this is more of freestyle. So first thing is a catch where the hand is entering into the water. So in which direction the hand is entering in, and the next stage will be pull. After entering, how you pull water under your body. That is the second stage of swimming, and how your hand exit the water and goes back into the air. That is more of recovery. This is the cycle of swimming, mostly in freestyle. And since we are more talking about injuries, so why exactly an injury happens? So we can definitely not avoid injury. It can happen. A lot of accidents happen. Even if we know very well how to drive, sometimes things just happen. But we can prevent like a small strain, sprain, or any other bigger events. So here, so what is exactly causing? So any repetitive activities, either it can be swimming or it can be any other activity that is repetitively done, can cause micro trauma in your muscles. So when this micro trauma is not treated or fixed early, that's when you see larger injuries like rotator cuff tear or a hamstring tear or calf tear. Sometimes you'll see ACL injuries. So these micro trauma, when we need to put stop to these micro traumas, that's what we need to learn. So what are the most common injuries we see in swimming? So there are actually shoulders are involved, your knees, back, and neck. So these are the main parts of the body that are involved in swimming. And the most that is being used is your shoulder. So shoulder, we can see impingement syndrome. There can be tendinitis, instability, scapular dyskinesia, and rotator cuff injuries. So there is a famous condition called swimmer's shoulder. So swimmer's shoulder is nothing but a combination of all these conditions is together called swimmer's injury or swimmer's shoulder. So impingement syndrome here, like now you guys been attending a lot of sessions and everybody is talking about rotator cuff injury, how an impingement happens, all that. So how an impingement can occur in swimming? So most of the activities what we do in swimming is this. So because of this is your shoulder. It keeps on rubbing on top of your shoulder blade. So if there is no enough gap in between those shoulder blade and shoulder, these two bony structures can rub together. And in between these two, there are a lot of structures going in and out. So when these two structures get compressed, what happens? There definitely be some inflammation. So that inflammation keeps progressing, keep progressing, and suddenly you'll be like, okay, I cannot lift my shoulder more than this, or I don't have any pain when I'm trying to lift my hand, but when I come into the mid range, I cannot lift my hand. So that is preventing me from swimming better, or swimming for a longer distance, or swimming for a more time. So these are the complaints we often hear from the athletes. So since all this impingement syndrome just don't start all of a sudden, so they would be definitely all these factors what I'm trying to tell, the instability, scapular dyskinesia, and rotator cuff injury, all must be underlying, which is causing to impingement syndrome. Okay, so instability, what exactly is instability? So your shoulder have to sit in a socket. So for it to sit in a socket, it has a lot of muscles, ligaments, and tendons trying to hold it in place. Now, because of a lot of muscle imbalance, so one muscle is stronger, one muscle is weak. So what happens because of this? There is some imbalance that is set in the shoulder. And now, finally, the structures which are holding the shoulder in place, they gave up and they cannot hold it any longer. So whenever you try to do the movement, the structures which are supposed to help and support the shoulder can't support. So what happens? It slides down and pop out. So this is what is instability. Okay. So when this instability is happening, to protect this, lot other muscles around the shoulder try to tighten up. When this tightness happens, that's when you see there is restriction in the range of motion. Okay. In the same way, scapular dyskinesia. So you might have seen people whose shoulder blade would be popping out. So this happens again because of muscle imbalance. So a lot of people don't train their retractors well. Always they concentrate on their pectorals. So they just stretch the pectorals, forget about what is happening in the back, and this will cause a lot of your rotator cuff injuries. And finally, with the combination of all these, we see this impingement syndrome. Okay. So what can cause these injuries? So overtrain, just push the athlete, or the athlete would be like, no, I need to perform better. So they keep training. They don't give enough rest periods. And why is it important to give rest periods? So in the start of the slide, we discussed that there are a lot of micro trauma that is happening during all of this. So any exercise you do, there is some micro trauma to the muscle. And that micro trauma, it has to heal for your muscle to go stronger. So now we don't give enough rest periods. That micro trauma does not have enough time to heal. So what happens? The muscle keep growing weaker. So when that weakness keeps growing, that's when you see the muscle is getting fatigued, or you'll see, oh, I have a grade 1 tear, or I have a ligament injury, or I have to go for a surgery. All this happens because of that. Okay. And what other techniques? So as I told you, there are 4 phases of stroking techniques in swimming. If you do not follow the proper stroking techniques, again, you see this impingement or any kind of injury. So most of the technique, it's this. So along with it, if you don't rotate your body, what happens? There is no much space for your shoulder to move. So if you don't rotate your thorax, the scapula kind of gets stuck. So the bone keep hitting the bone. So that's when again you have those impingement, instability, all good stuff happening there. Okay. And other thing, of course, breathing is the main thing in swimming. So during breathing also, there are positions for the head and the trunk. And if you don't follow those positions, again, there is high chance of injury. And if there is any less range of motion, or there is weak muscles that's there in the shoulder or core or in the hips, again, all of these factors will lead to injuries, what we discussed in the previous slide. It's just not the shoulder. The knees are affected, the hips are affected, back is affected, and the neck is affected. So any kind of injury in any sports, we need to make sure we get proper rest, we are following the proper technique, and we need to see if we have good range of motion, good flexibility, good strength. So these are the ones that can prevent injuries. Okay. So what can exactly cause these injuries? What is the mechanism? Now we are keep on moving, keep on hitting in the wrong, we are using wrong techniques. Now the muscle is inflamed. Now we are not treating it. What happens? The body is very smart. The body will try to find a certain way to do this movement differently. So when that happens, your muscle imbalance is happening. So now my shoulder is affected and I'm not treating it well. So what I do, instead of doing this, I do this, because the body is learning a different technique. So now definitely my shoulder flexors are not strong anymore, but my trapezius is tight. So instead of my shoulder flexors working, something else is working. So that's why the muscle imbalance is setting in. Okay. So what exactly happens? Now this is keep on going on, keep on going on. We ignore it. So now the muscle or the connective structures that are around the shoulder, they're getting shorter. Now, when the muscle is shorter, it cannot absorb a lot of force inside it. And when it cannot absorb a lot of force, what happens? Slowly, the tendon or the muscle, anything starts splitting out. That's what is called fraying. So when it splits out, or this is more in the joint. So when in the muscle, it kind of splits out slowly. That's what is your grade 1. And slowly, when the muscle cannot absorb anything else, it'll just like boom, just stare. Okay. And sometimes you might be seeing athletes on the pitch or in the pool saying that I was trying to do the movement and suddenly I got a catch. So why these things happen? So there are two groups of muscles always that are involved in contraction and relaxation. So if these two are not going in balance, that's when you see this catch. Or when there is less muscle strength, that's when you see the catch. There is much less strength and the muscle does not have the space to contract and relax because of the tightness. What happens? All the force is getting distributed somewhere else instead of in the muscle. So it directly goes and affects the bone. So that's when they'll be like suddenly they're holding and they're just falling on the field saying that no, I can't do it anymore. So these are the things that can happen when you keep on doing the repetitive activities, wrong repetitive activities. So these are a little bit more of core elements that happen in swimming. In swimming, we mainly want to concentrate on body position, how you breathe, how the arm move, in which angle it should move, whether the elbow should be higher or lower, and how you're pulling the water under your body, how many kicks you do during the first phase of your clutch, how you're doing it, and rotation. This is the one of the main important concept. If you do not rotate your body during the process of swimming, you see a lot of shoulder issues. Okay. So this is the shoulder. We spoke about what exactly happens inside. This is the space where all the structures go in and out. So when this shoulder moves up, if there is no enough space, the shoulder bone keeps hitting the acromion, and that's where the inflammation starts and all the pain starts. So as we said, now we are doing repetitive activities, and that is causing micro trauma. Now this muscle does not have good strength. So what is leading to it? It's leading to laxity. So that laxity leads to instability. So when there is no good enough strength in that shoulder or the muscle, what happens? The shoulder try to slip out. When that slipping is happening upwards or forwards, again there is some impingement happening in the area. So in swimming, sometimes we just want to overload. So you keep on swimming, and what happens? That causes this muscle, the supraspinatus muscle, to thicken up. Okay, and that is even leading some inflammation. It's called tendinopathy, and that is also causing pain. Now, tendinopathy is happening. We already discussed because of the less muscle strength, there is some laxity. So you don't know that your shoulder is slipping out, but it is happening. And now to prevent it, there are a group of muscles called rotator cuff muscles, which give stability to your shoulder. They need to act in place. So now they cannot hold it any longer. So they're getting fatigued. So now this fatigue is happening, muscle imbalance is set in, all your posterior capsular muscles are into tightness. So now when that tightness happens, your shoulder blade moves forward, and that is leading to dyskinesia. So this dyskinesia is nothing but improper movement of your scapula or any movement of any bone. So that will lead to, so now your shoulder blade does not want to move good. So what happens? You automatically try to compensate in your swimming. Instead of swimming straight, you want to increase your range on other side more. So that will lead into a pathomechanics. So it's just not the shoulder, even the knees kind of hurt in swimming. So this is called breaststroke knee. This is mostly seen in breaststroke style of swimming. So what happens here? So do you see this guy? The amount of abduction, means moving knees out of the midline, is too much, which is causing more impingement in the hip and a lot of stress in the inside of the knee. So when there is a lot of stress in the inside of the knee, what happens? The muscles, the ligaments, what are attaching your upper thigh to the lower leg, they are overstretched. So how long can something be overstretched for? So when it keeps on stretching, it gives out, and that's when we see MCL injuries. You have more of compression pain on the outside of the knee. So this is not, this is very treatable condition if you address it quick. So that's why we need to know more about it. So even we know that back is also getting affected. So spondylosis, this is what you see. So you see it in more of butterfliers and breaststroke swimmers. So when you're underwater, when you're doing these techniques, your back is more into extension. When there is a lot of force into the extension, all the force is happening on your this part of the spine. So once this is not able to take any more force, then we see fracture. And once there is fracture, there is no stability for this part of your spine. So what happens? It just slips out. So this is called spondylolisthesis. So this is another, when you have back pain, you're a swimmer or anybody, it is very, very important for you to get it checked than ignoring it. So because when there is a fracture in this area, sometimes you don't have any symptoms other than pain. You won't have any loss of sensation. You won't have any loss of muscle strength. So you'll be like, okay, it's just muscle, back stiffness, or I work too long, that's why my back is hurting. So it's very important to get it assessed. That is one good thing. So how can we treat these? So we gave you a lot of options saying that you shouldn't do this, you should do this, all that. So once we see an athlete is having issues with the shoulder or knee, how can we correct it? So we need to first of all talk to the coach and see if we can modify the training factors. What is exactly causing the pain? So we need to communicate that with the coach, and we change the stroke mechanics. Probably if the athlete is not rotating well, and that is causing more of impingement, or the athlete is abducting their legs too much, that is causing pain in the hips and the knee. So we assess that and recommend the coach, saying that this is what is happening, and if he can teach the proper stroke techniques. So that is one thing. And we need to give them workouts in such a way, initial phase of rehab, that the strengthening should be in pain-free range. So we need to give more of dry land workouts instead of in the water, so that we can deload that muscle and increase the rest and recovery time. So that is the most important factor that we need to work on. And do not just because the pain is gone, just don't send the athlete directly into the water or into the field. So we need, here is where we can take help of all of our wonderful SNC support. We can take help from them, do good conditioning program, and return them to the sport gradually. So we do different techniques also. So one is manual therapy in it, more of cervical and thoracic spine, to see if there is any restriction in the range there. So if there is restriction in the range, using different kind of manual therapy techniques, we try to open up that space so that there is enough space for your shoulder to move around. And these are another few techniques what we use to rehab the person to go back to normal. So we need to first see if mobility is important or the lengthening is important. What is more important in that athlete? If there is less range of motion, let's work on increasing that range. So the same, again, if there is any muscle imbalance, what kind of strengthening should we give to the person? And I have seen a lot of people doing stretch, holding and trying to twist the hands back just to stretch their pectorals so that they can swim better. So that is really a wrong way to do. Instead, we can try to stretch our posterior capsule. That gives us more room to swim. Okay. So how exactly can we prevent these things? Warm up, warm up, warm up. We have been specifying this for a long time. So definitely warm up is one of the best solutions to avoid injuries or prevent injuries. So 10 to 20 minutes before you start the activity is very good. You can start with dynamic. You can use activation of specific muscles. Since we are discussing about swimming, we should work more on external rotation activation. We can give more of flexor activation, or you can hold a TheraBand and try to do the same, imitate the movements of swimming. These things kind of help. And again, adequate rest and recovery time. So you try to using SNC expert support, we can do periodization of training, so that way we can have some recovery for the muscles to avoid these injuries. And weight training is another important key factor here. You just keep swimming or you keep training, it's not going to help. You need that muscle strength. How do you get it? By doing weight training. So with proper structured and tailored weight training program, we can avoid a lot of these injuries. And why I mentioned psychological evaluations here. Now we have all the muscles in control, but if this is not in control, which is controlling the rest of the body, everything is going to go waste. So our psychological experts can help us with this to see how they can be on the field, or how they can be in the water, what they need to think, and breathing techniques. So that will also help in preventing our muscle injuries. And cool down. Yes, now your muscle is under a lot of stress after you keep practicing for maybe 2-3 hours, and this is the time you need to let those muscles go back into a normal state and relaxed state. How you can do it? Just do some static stretching or just float in the water. These are there are a few other cool down techniques. Definitely your physio can discuss it with you. So I have few videos to share about what kind of dynamic stretches we can do before. So let me just show you I hope everybody can see the video. These are few dynamic stretches we can apply. So this is basically trying to help our hip. Concentrating more on hip mobility and adductor stretch. Here your calf is also getting stretched. Again, working more on hip mobility. So that's all for today. It's a short and sweet session. I wanted to give just an overview about what we can do in swimming and what other things can we alter to prevent most of these injuries. And if you have any questions, I can take those questions now.
Good morning, ma'am.
Good morning.
Can I ask you a question, ma'am?
Yes, sure.
See, thank you for a nice presentation. But then, see, it is like this. You told the various causes of injury, but then how do we prevent it? For that matter, if I'm a breaststroker, how am I? Who will tell me? Yeah, what am I? I'm stretching my whatever that angle bit. What is more? Because there
So,
is no technology or
that's where all the sports scientists come in play. Okay, and the biomechanist and physiotherapist. What we do is we try to assess. So a dry land swimming we try to do and see where exactly the issue is. So if in swimming if you're not raising your elbow over your hand, or if it is not less than 169 160 degrees, but we know definitely you have high chances of injury in that shoulder. So what we do is during the practice sessions we sit with the coach. The coach is the expert here more than anybody else. The coach knows exactly what technique is supposed to be used. We just recommend saying that, so instead of going straight, the athlete is going this way, that is leading to all the issues. So we sit with the coach and we say, can we modify this, or how can we explain this better? So that's how we can prevent these injuries. Did I answer your question, Mr. Fernandez?
no. My worries are see my. Coach, there are many swimmers in the pool. Will he be able to see it so closely? Because unless there is recording done and maybe afterwards seeing the recording and see here you go wrong.
Exactly. Yeah, we really wish we have all the technology. That's why I said we can do dry land testing in sports science blog. We do dry land testing. That's how we can find out that this is where the technique is going wrong. So these days there are a lot of underwater cameras that are available, force cameras that are available, and we are really looking forward. Probably Sai will provide us more in future. All the technology is slowly coming in, so we are hoping for that also to come in soon. That will help the coach. So in any field, any game, the coach is able to assess for somewhat what is happening on the field. But once the video analyst or the biomechanist, once they give the video of what exactly the athlete is doing, that's when we have a clear picture. Okay, so definitely with lot of athletes, coach cannot concentrate on one. That's when we come in play saying that, hey coach, this is what is going wrong with this athlete, or can we concentrate on so and so movements. That's how we give feedback to the coach.
Okay, thank you so much. Thank you.
You're welcome.
Thank you. Thank you.
Any other questions?
Hello, can you hear me?
Yes.
Yeah, hi madam, nice presentation.
Hi. Thank you.
I'm Arindam from STC Agartala. Like certain swimmers, what they do, they learn wrong technique and they join like STC or they get selected. So sometimes when I correct them, it takes years to correct the technique, and the wrong practice is so much that if I correct their technique either in the breaststroker's knee or in the freestyle, they get injury. So at that point of time, what can be done, or what is the idea actually?
So definitely, since their muscle memory is really good, they have learned that wrong technique. But it is not that difficult to put them back into right technique also. So we need, because of the wrong technique, first of all, they might be having few issues. So we need to address those few issues first. What exactly is causing? So now, because of the wrong techniques, maybe their pectorals is extremely tight, okay, and the scapula is extremely weak. So what we do in taking help of physio or strength and conditioning expert, we try to relax these structures and strengthen the back structures. And while we're doing that, the coach can actually give them more of on land or dry exercises. We say, saying that using resistance band, you need to do this movement. So we need to restore or replace that muscle memory so that they can go back into the correct technique. Did that make sense?
Okay, means more kind of therapy and exercise, more trial and exercise we have to do for
Yeah.
correcting that.
Yes. So,
Yeah,
and
yeah.
even like instead of just going on into the whole body, what you can do is we can do segmental, work on
Divide, yeah.
more just hand movements and then the whole body or rotations. So, and other main thing that can help an athlete is visual. Anything they see that can be remembered very well. So now these days in Bangalore Science Center, we use a VR system where we train them using that VR, saying this is how they need to move. So that can also improve the muscle memory. So
Yeah.
that is another good technique to improve it.
Thank you, ma'am.
You're welcome. Any more
Yeah.
questions?
Hello. Yeah, madam. One more question.
Yeah.
In your PPT, you have written gradual return 10% per week. What is that?
So when we have an injury, right?
Yeah.
So when we have injury, we cannot just send the athlete back into the activity. Okay. So now, if the athlete is doing 10 strokes in 1 hour, that's just an example. It's too less, but yes, I'm saying it's just an example. So he's doing that. That is his maximum. So we need to calculate, saying that okay, maybe he can just stay in one spot and do just the arm cycles or leg cycles. That is what is 10%. The slowly progress the activity, instead of just saying that okay, now you don't have pain, do 100 cycles. You can't do that. So that is what is gradual progression means. Okay.
Thank you.
Because the muscle need that strength to hold the forces that are coming from the water or the muscle itself. That's why. Okay. Thank you everybody for attending the session. And if you have any questions, you can always reach me through my email. And thanks Sai and CAIMS for giving us such a platform to educate everybody and educate ourselves also. So thank you.
Ma'am, sorry, could you please give your email address, ma'am?
Yes, I'll write that in the chat
Box. Yeah. Thank you so much. Thank you.
Thank you, Dr. Heera, for this wonderful session. Thank you all participants for attending this session. We will meet tomorrow. Tomorrow the presentation will be on specific sports injury and their prevention in rowing. It will be presented by Dr. Ganji. So I would request to present tomorrow as well at the same time. So thank you for attending this session. Goodbye and take care.